Welcome back to Money Sense Television. I'm Ken Reed. We've all heard the saying, dress for success. Perhaps it's time to consider smile for success.
Thousands and thousands of years ago in early man, teeth were a weapon. The sharper, the more gaps, the browner and uglier they were, the more they were twisted, the better that you could use it to use as a weapon and to tell society at that level, stay away, I'm the dominant one. Today, the smile is being asked to do the opposite. We're saying, you can work with me, I'm friendly, come closer to me.
If a good smile is a new weapon in the corporate jungle, then Dr. Ed Phillips is helping people arm themselves with cosmetic dentistry. By placing caps or porcelain veneers on teeth, he can dramatically improve a person's smile.
The type of dentistry that we're providing can be in generally anywhere from $3,000 to $10,000. That's a common range what people will spend. It's not easy for the public right now to afford these kind of treatments, and certainly most of these treatments are not covered by insurances. So who are we going to see pick up on the trend? We're going to see the business people who have the funds available or will feel that these funds are justified to be spent because they'll help their careers.
Gord Griffiths is an executive whose teeth were worn down and discolored. He had 15 teeth capped at a cost of $14,000.
I used to walk through plants and not smile, and people would wonder, what's wrong? There's something wrong, the boss isn't smiling. But I tried to force myself not to smile. I tried to keep my mouth shut so nobody would ever see my teeth.
Gord recently changed industries, and he felt he needed to change his image as well.
In the old industry, everybody knew me. There wasn't a door closed. People who worked for me knew me. First impression is very important, and although I believe substance is the most important thing and always will be, nobody knows how good you are if they haven't met you.
You spent $14,000 on the procedure, but what kind of a return do you think it can bring back to you?
I can't say a concrete number that it's made me X number of dollars, but I do feel that the doors that are going to be open because of my new self-image about myself and my confidence and going into a new end of the business, I believe that we could be standing here 5-6 years from now and I could be telling you the new Gord with the new teeth has made millions of dollars, and I honestly believe that.
When I'm getting in front of these people, I'm speaking and everyone's looking at me or looking at my mouth. Not worrying about are they missing a message because they're looking at something else is a really important thing to me.
Carol Ferguson is a human resources consultant who had porcelain veneers placed on 8 of her teeth because they had been discolored when she took tetracycline as a child. Her procedure cost $7,200.
I feel that I probably had a healthy sense of self-esteem. What getting the teeth fixed did for me was give me a little bit more self-confidence. And that's important for me in my job as a consultant, working with a number of business clients and helping them do facilitations or sitting down with a group of executives. So having that little bit of extra confidence was really important.
In porcelain veneers, we are taking a very thin plate of porcelain that is pre-made by a ceramist to the specifications that that person needs. So if their teeth are twisted, we can untwist it by putting a surface coating over your natural tooth, giving it the appearance of being straight. And oftentimes teeth are shorter, which we can then lengthen them, and we can also change the color.
With the new technology in cosmetic dentistry, people can often achieve the same results as they would with orthodontic work, but in a lot less time.
The braces would have taken 3 years, 4 years, a lot of dental time, a lot of appointment time, time that business people can ill afford. The beauty with veneers is we can correct the functional problem and the aesthetic problem, and very often do it within 1 week.
The importance of that is that it's a very small period of time out of your life, whereas if you were having to take several weeks or going back and forth for treatment and trying to work that into a business schedule, that would be a lot more difficult to facilitate.
I joke with my wife about spending $14,000 on myself, but she said, look, you have 30 more good years, and better to spend money on yourself or each other than to be putting it into cars or homes, etc. And that's the reason I did it.
If you're thinking of having some cosmetic dentistry done, here are some things to think about. Insurance companies don't pay for pure cosmetic dentistry, but chipped teeth and old discolored fillings can be replaced if the integrity of the filling is not sound. This will be covered. Veneers are placed on a per-tooth basis and range from $600 to $1,000 per tooth. Whitening varies from $350 to $600 for the dentist-supervised at-home treatment. And composite resin bonding costs between $200 to $500.